Hello, everyone. Welcome back to another Facebook Live. I'm Rob Hoyle, and we are here at the Mother AME Zion Church. I'm joined by Reverend Malcolm Bird and Dr. Debbie Salas Lopez, and we're talking about COVID-19 testing that's been happening in churches all throughout our communities at Northwell is partnered with Faith-Based Communities. I just want to say, before we start talking about that, this church is beautiful, and there's a lot of history here.
Yes, this is the oldest black institution in New York State, originally founded as a church in 1796, but our origins are actually a little earlier than that. We began as a secret anti-slavery society in 1774. So this congregation was a stop on the Underground Railroad. Some of our more prominent members were Sojourner Truth, Harriet Tubman, Madam C.J. Walker, Paul Robeson, and others. So for 2 centuries, this church has been very committed to pavement level justice throughout the years.
That's awesome. And so we just had some COVID-19 testing done here in the last week. We had it done, and we're still doing this. All the churches. Just, Debbie, tell us why it's so important for to get testing done in some of these minorities.
So we're so proud. Northwell Health is so proud to be partnering with the state of New York and Governor Cuomo's office, and of course with our faith-based leaders to address COVID-19 testing. Particularly since these are the communities that have been disproportionately affected by COVID. And so we're happy to be here in collaboration with faith-based leaders because they're the entree. They're the trusted community member and community leader. And as such, to do this in partnership with them is an honor for us. And we have been very successful thus far. We're in about 48 churches as of next week, the end of next week. And our goal is to continue to do this within our communities. We know that there are disparities already. There are social disparities, there are health disparities, and this is just one way that Northwell Health can give back, if you will, to the health of a community that needs it.
Yeah, and we've seen a lot we've been talking about a lot of disparities in the Black Lives Matter movement. How has that helped the community and for people to be more aware?
Well, in the black community, we have always been aware of the disparities. But what we see now, especially with this relationship with Northwell Health, is that for once black people are not just subject to be studied and experimented upon, but now there is a concerted effort to do something about what we have been experiencing in our communities: unequal access to health care, testing of things of this sort, especially regarding a pandemic that has ravished our community in just about every possible way. This relationship between our faith-based groups and Northwell is vital. It is historic in how it addresses the disparities that minority communities experience and have always experienced. But now there is actually a health group that is helping us work through it, and that's a big deal to us.
Yeah, that's awesome. We hear a lot about social determinants. What exactly are social determinants of health?
So social determinants of health are those things that impact health and healthcare and access. So as an example, poverty is a social determinant of health. Transportation, lack of, food insecurity, housing insecurity. Those are all things that are social injustices that affect health and healthcare for poor communities. And we're happy that we can stand in solidarity with the Black Lives Matter movement, because we do believe that social justice and racism, right, are important things to talk about and to address and eliminate in time and in collaboration with faith-based leaders and other communities of color. So we're really happy to be here. We know that there are many things that we can do, because united we're stronger, as opposed to taking these issues out on our own. Doing it together is really the way to go. And you could see it on the streets. When we were testing here, the Reverend had come back from one of the demonstrations, and so we're happy to be part of it.
I have so many questions for both of you. If you have questions, please put them in the comments section. We're going to try to answer as many as we can. We talk about some of these communities being hit harder, and we mentioned before, you lost 12 people from this church alone.
Yes. There's a very difficult time in our congregation where persons, very faithful, very loyal, incredibly active members of our congregation that we lost due to COVID-19. And that's why in the midst of this chaotic season in which we are in as a community, as a nation, it makes a great amount of difference for partnerships like this to develop, because what Northwell has been able to do within the Black community is a reaching into our community that I have not seen in my lifetime. And so saying Black Lives Matter is one thing. Having a sign in solidarity in a protest is one thing. But when the protesting is over, who is still committed to the fight for human liberation and dignity for my people that also includes access to health? And so that's a big deal.
And
big deal for me.
Northwell Health is.
I see that.
And Northwell Health will be with you.
I see that.
You know, it's interesting because we took care, I want to say, the most people with COVID-19 in the country.
Yes.
And so we have firsthand knowledge and experience with what COVID-19 as a pandemic did, right? I will tell you that it'll be easy for us right now to just focus on recovering because the number of admissions are down and the cases are down. Instead, we chose to come in and spend time with our faith-based leaders in our churches and our communities to start to educate and go upstream to prevent, hopefully, another pandemic, but certainly to educate our communities of how important it is to stay healthy, to be well, and to protect themselves. And so this is an opportunity for us that we're not going to rest on what happened. We're going to keep going and actually try to prevent and promote better health, particularly in our communities of color.
Yeah. And this is something that once the pandemic's over and there is a vaccine and we're not worried about COVID-19 anymore, Northwell will still be.
We're going to worry about other things, diabetes, hypertension, obesity, all of the things that are important in our communities. And so we're happy to say that this is the beginning of what we hope to be an enduring relationship with our communities.
Yeah. That's key. That's key.
And we talk about faith-based, so Northwell has been doing this not only in churches, but in temples and in mosques. And why is it so important to have that connection with the spiritual leaders?
Well, because we are trusted spaces. We are spaces where persons devote their time, their talent, their energy for generations. I have a woman in this church, Mrs. Catherine Nixon. She sits right over there. She'll be 100 years old in September. And when the doors were open, she was in church every single Sunday. This place means something to her. And so that is largely why the thousands that Northwell has been able to test within our Black and minority communities is largely because it happened in trusted community spaces. And this is a community-based approach to health that I know without question will benefit my community and other communities into the future.
What we found to be true is many of the pastors and the ministers and the faith-based leaders actually led by example. So not only did they announce it during their virtual services and continue to do that, but they stood in line. They wanted to be first in line to be tested. What a great example to their congregants that this matters, that this is important, and that education around COVID is important. And so we were happy to see not only the enthusiasm of the community, but the enthusiasm of our leaders.
And I guess it's amazing for Northwell to be able to come into a space like this and other spaces traveling with, and what has it been like for the clinicians for Northwell to be part of this?
So this church is special because our senior leadership, Michael Dowling and others came, and the Reverend took us to a museum that's downstairs. And we got chills from looking at some of the artifacts that are down there. They're so apropos to what's going on in the country. And then we sat here, and the Reverend played that beautiful organ for us. And it was so inspirational. The sanctuary is certainly a place that we look forward to spending time with you on.
Hey, we're getting a question from Liz from our audience. She wants to know, have you learned anything from the faith-based testing? What have we learned so far?
So many of the communities, so disproportionately, we have 2 to 3 times higher positive rates for the antibody as well as the PCR, the diagnostic testing that you have in other communities. So we've learned that that is true. The other thing we've learned is that the community wants disproportionately the antibody testing because they think they've had it and they just want to confirm that they've had it. And so those are 2 big things that stood out for us. And then the other thing is that the enthusiasm, they're coming out to get tested. They're not afraid. They're coming in. They're asking questions. They want education. They want to learn more. And so we're learning a lot from that as well. We're learning a lot from our community as well as them from us.
And I guess that learning is something that will continue with the data that's gathered.
Yes, it will. You know, we're going to look at the data, and we're going to give the data back to every pastor would have his own congregation's data so that they know. That's key, right? To the congregants in the community that got tested here, they'll know what their rates are, so that then the pastor and the minister can inform and continue to educate their community about social distancing, wearing masks, the importance of hand washing, and things like that.
Yeah. And so, one of the things that I think people, don't understand is why sometimes in the minority communities that the cases are higher. And can you just give us a couple of reasons? I know, like, one, maybe a lot more people have to rely on mass transportation, but tell us some of the other reasons.
The mere fact that one thing that we must do is to socially distance ourselves. Simply saying that is actually a privilege to be able to actually do. And so when you talk about social distancing, the privilege of being able to work from home, to stay away from large groups of people, is a privilege not often embraced by persons who live here in central Harlem. And so when you look at how these numbers are so high, you're dealing with people who have already been marginalized in every possible way in life. Unequal protection under the law, which can stress you out if you allow it, you name it. And so there are a number of things that contribute to these high numbers in our community. But thankfully, though we know that COVID-19 will, of course, be dealt with medically, we know it will be conquered, but we also still have to deal with the pandemic of racism that has been around for a very long time and how that shows up in health disparities in our community. Fortunately, partnerships like this between Northwell and our faith communities direct us to dealing with this issue of racism as it relates to health and putting us all on an equal playing field, where a kid in Harlem is just as healthy as a kid in a more wealthy community elsewhere.
Right. And so when we talk about what the work that Northwell Health has been doing to address these inequalities, this is something, too, that's been happening before this pandemic.
Correct. Yeah.
Tell us some of those things that were happening.
So fortunately, we have tremendous leadership and acknowledgement that the social determinants of health matter in terms of health and health behaviors. So in 12 of our hospitals, even before COVID, we're collecting, we've screened about 100,000 people already within our communities, looking at the social determinants of health. And we're actually proactively connecting them with community-based organizations and social services agencies within the community to help them, whether it's food insecurity and food banks. We have a Food is Healthy collaboration and partnership where 12,000 of our community members and our patients have been referred to food banks. And so we're working collaboratively on issues that are social issues with community-based organizations, our faith-based leaders, and we will continue to do that. It's important. It's important to our patients, our community. It's also important to us. We're only going to be as healthy as our most vulnerable member in the community.
Absolutely. All right, we got a message from, a question from Christina. Are there other future community health initiatives Northwell will be doing after COVID?
Yes.
Just talked about it,
yes.
let's talk about it some more.
Our goal would be to continue to do this. We believe in it. We know that it's important. We're fortunate to be partnering with the state of New York and Governor Cuomo. We will continue to do that. And so we're going to go out to wherever we have a community need that's identified to continue to do this. And our goal would be to continue to do this beyond COVID for the things that the community is affected by. And interestingly enough, we don't want to do this thinking we know what the community needs, right? We want to collaborate with the leaders that work with communities that can actually help inform. What should we be talking about? What should we be educating our community about? What about access to health care? And so we hope to continue to do this over time. We're certainly going to continue it through the summer, and we'll look forward.
And how important is that partnership for you to have with the health system and to be able to talk to your community? I mean, you have your pulse on the finger of this community. How important is that?
It is of vital importance, and I will say it, and I will say it again. I don't know of any healthcare group in the country that has such a hands-on approach to minority communities as Northwell has had here in the boroughs of New York City and Westchester and elsewhere. That is tremendous. It is historic in every possible way. And I have observed in these various sites, and of course clergy persons talk to each other. We all talk about what happened at the site out in Hempstead with Dr. Easley and others, so we are fully aware of what's been going on. And so we've been comparing notes, and one thing we all share with this is that this is the first time we've seen it happen, of a group coming in to help our community with this pandemic in a way that did not make vulnerable people feel like they were the next Tuskegee experiment. And that is significant in every possible way. So I look forward to a continued relationship with Northwell, and I've made it very clear that Mother AME Zion Church can be perpetually an annex health center for Northwell Health. I've made that very clear.
Thank you.
And do you think being, better health is going to be something that also leads to more equality?
Well, that is the hope. That is the hope. Health is wealth, and we take that very, very seriously. And I want my people healthy and wealthy in every possible way.
Awesome. I just want to have a couple more questions before we wrap up. So how is technology, this was a question somebody had, how is technology also playing a role? I think we talked a little bit about, and how will it play a role going forward?
So fortunately, we were able to bring in our technology here. So when our patients and our community and our church members are tested, we're able to sign them on with our lab. Our lab is doing all the testing. And so we're able to, using technology, connect back to the mainframe of the system so that we can get the results. Also, we're using technology to communicate the results back to anyone that was tested. And so you can use email, we can use your phone, a text. And so technology is playing a role for communication. That's really important, both for testing and getting your results, but also for education.
And how important is this for the community too, to be, have that access at their fingertips, and maybe be able to go to, website, or even if it's the church's website that'll take you to the...
It makes a huge difference. For the most part, our congregation, as most faith-based groups are an aging population in the pews, aging. But they have and they know fully how to get onto their iPads and how to look up certain data and information. And frankly, as much as I hate to say this, I have some seniors in the church that are more informed regarding technology than I am. And so this is a way in which we can get information to our community. Newspapers are great, but the way of the world right now is, can I access it from my smartphone? And Northwell, along with our faith-based groups, have been making it very easy to ensure that people have the data they need in their community. They know where to go for services should they need them. Even announcing, Reverend, the initiative to come get tested was done using social media.
Totally. Instagram, Facebook. The churches and the faith-based leaders developed their own brochures to advertise. So even that piece was important in terms of technology, because people are not congregating in the churches anymore. So you have to do virtual services, and you have to advertise using Instagram and social media. And so that was really important, to get the word out, to come in to get tested.
Okay, we're about to wrap up. Final thoughts.
Final thoughts is, it is my prayer and my hope that this partnership between our faith-based groups and Northwell will continue, because the race is not given to the swift nor to the strong, but to the one that endures to the end. And it is my hope that we will partner together to the end together.
Thank you. And my final thought is that it's an honor and a privilege to be here with you today. And thank you for allowing Northwell Health to be part of your community during these times.
Honored, and we are grateful and thankful to Northwell as well.
Thank you so much. I'm Rob Hoyle for Reverend Bird and Dr. Debbie Salas-Lopez. Have a great day and stay safe.